Library Surgery podcast, and the title of this episode is The Trouble with PICO. Hello, my name is Matt Holland and I'm the Library Manager for LKS ASE. Welcome to the Library Surgery podcast. We may think up a better name later. Please do suggest one if you'd like to. So the Library Surgery podcast is going to be an informal chat about frequently asked questions relating to the library, searching, finding information, and any other questions that drop into the library mailbox. The podcast is less than 10 minutes, so hopefully that's just long enough to cover the topics we want to cover without taking up too much of your time. It would be great if you could comment or feedback to me on what you want me to talk about, and you can contact the library at library@nwas.nhs.uk. That's library@nwas.nhs.uk. The topic I want to cover today is PICO, which stands for Patient or Population, Intervention, Comparison, and Outcomes. There are a few variations on this. I've also come across PEO or PO and PESTO, PESTO as well, and there may be more. Essentially, these are structured ways of producing clinical research questions. I know many of you are asked to use PICO in assignments, and I'm not questioning its value. PICO may well work for you, and that's fine if it does. However, I'm going to point out one problem which may explain why it's not always the best solution when searching for journal articles and other literature. So I get quite a few questions like, here's my PICO and my research question, but I've searched X number of databases and I can't find anything on the topic. The problem is that PICO and its relatives encourage you to be extremely specific to the point where you can miss most of the useful material. So let me explain why that is. In paramedicine, as with all new subjects, there's not that much research literature on any particular topic. Although the literature is growing all the time, you're still fishing in a fairly small pond compared to, say, the wider medical literature or even nursing topics. So the most sensible approach to take, I would always argue the best approach when searching, is to use a broad search strategy first. Search strategies derived from PICO generally take a narrower approach for two reasons. First is that they encourage you to search for 3 or more ideas or concepts aligned with the PICO acronym. Without getting too far into the weeds of searching, if you search for journal articles that contain 2 ideas, you'll probably find a few. If you search for 3 ideas or even 4 ideas, you're going to find very few or even nothing at all. Second reason is that the language or keywords used to express, for example, population or outcome, can be very specific and exclude useful material that might not mention your population. However, they might have been useful to you. What to do? Well, here's what I do quite often when I'm asked to troubleshoot a PICO question that isn't generating any material. First off, I look for the 2 big ideas in the search and search just for those. As in nearly all cases, we are dealing with too little material. That usually solves the problem. Just to elaborate a little on this, in a situation where there isn't much material, you can make a few assumptions about the population and outcome, which negates the need to specify them in your search. For example, comparing 2 drugs used in the treatment of a condition, if you search for the 2 drugs in the same article, or even mentioned in the title, then you can assume that they are comparing the 2 drugs. Search for that and the condition you are interested in, and you'll find most, if not all, the relevant literature. Another thing I do is hand sort the results. This has its limits, as you can't do this with too many results. I have a personal limit of about 50 or 60, which on a typical result screen is 1 or 2 pages. And just pick those results that fit your PICO. Although it can be time consuming, it might be more effective in finding the material you need than trying to craft a perfect search. If you're not sure how to do this, you need to work it out for the database you are using. Essentially, you're saving the results you want into a folder and leaving the ones you don't want. So you just export the ones you've added to the folder when you finish. Finally, you should consider whether one search is enough. You might need to approach the same topic from several different directions to make sure that you have all the possible journal articles on that topic. I just mentioned this as an addenda, but is it you that's the problem? It can affect any search and not just PICO. So here are a few things that could go wrong. Are your spellings correct? Some drug names are hard to spell, as are some medical conditions. Check on Google to make sure you have it right. Also, do you have all the relevant keywords? This can have a dramatic effect on your search. If you're searching for paracetamol, have you included one that's hard to say, acetaminophen? Also, check your search results for American and English spellings. So, if you have followed all this advice and you still can't find anything, then you might conclude you have found a gap in the literature. Put simply, there is no research. If you come to that conclusion, then a change of topic, or at least a tweaking of the original topic, may be in order. Not to worry about that. Half the requests I get with helpful PICO start with the brave words, I've changed my original topic, can you help? And of course, I can, and good on you for making that decision, a brave decision. The takeaways from this episode are essentially 5. Try to keep your searches simple and broad. Consider whether you need more than one search to cover the topic. Sorting through your results by hand might be more effective than seeking to craft that perfect search. Make the obvious checks for spelling and missing keywords. Don't be afraid to modify, refine, or change your topic if the evidence is telling you there just isn't any research. Well, there you have it, the first episode of the Library Surgery podcast. I'll be releasing another episode soon, so watch this space. If you can think of any topics you would like me to talk about, just let me know. And thank you for listening.